Good morning. I'm Joanne Conroy, and I want to thank all of you for joining us here today for Health Policy Grand Rounds with New Hampshire State Senator Dan Veltes, who is running for governor of the state. The Health Policy Grand Rounds are part of our Dartmouth-Hitchcock We Care, We Vote initiative, which is a nonpartisan voter education program designed to empower and educate our employees. All candidates for federal and statewide offices have been invited to participate, and recordings of all of our discussions can be found on Dartmouth-Hitchcock We Care, We Vote website. Senator Veltes is serving his third term representing Concord in the New Hampshire State Senate. He is currently the majority leader of the Senate and is running for governor. He lives in Concord with his wife and 2 daughters. He's a graduate of the University of Iowa School of Law and earned his master's in public policy from Georgetown University. Thank you for being here today, Senator.
Thank you so much, Dr. Conroy, for the invitation and for having this discussion.
Great. So just a little housekeeping for everybody. The senator is going to give us a few remarks, overview of the things that he's been concerned about in terms of his speaking with citizens across the state and the things that he would hope to accomplish in a leadership role in the governor's office. But I'm also going to be monitoring the chat room. And so please put your questions in the chat room and I'll make sure we integrate it into the list of questions we already have for the senator. So Senator, the floor is yours.
Well, thank you very much, Dr. Conroy, for having this discussion, for all that you do, for all that Dartmouth-Hitchcock does for our state, and for all of the healthcare workers, for all that you do during this pandemic. I live in the south end of Concord with my amazing wife, Erin, our 2 wonderful daughters, Iris and Josie, our 2 dogs, Franklin and Roosevelt. And I have a little bit of a different background than the current governor. My dad wasn't governor. My brother wasn't a U.S. senator. My dad worked in a furniture factory for 45 years, same one, unair conditioned, doing the same job each and every day for 45 years. My mom, she did part-time work, including the night shift, while raising 4 kids. And the gifts they gave to me were the values of hard work, honesty and integrity, and looking out for everybody, especially those who need it most. And those are the values I've tried to live my whole life. Right out of law school, serving as a legal aid attorney with New Hampshire Legal Assistance for about a decade, fighting for low to middle income families and seniors and veterans, including helping folks during the last economic crisis, the Great Recession, battling Wall Street banks who were foreclosing on folks all across New Hampshire, helping people get access to health insurance and unemployment, helping people get back up on their feet. So many of those same folks that fell through the cracks back then are falling through the cracks right now in this public health and economic crisis. In the state Senate for 3 terms and as majority leader, led the way on issues from Medicaid expansion to prescription drug relief, capping out-of-pocket expenses for insulin at $30 per month, importing safe, low-cost prescription drugs from Canada, leading the way in paid family and medical leave insurance, clean energy, all the while, though, bumping up against the same obstacle. Kristen Nunu, who's running for a rare 3rd term, set a record in vetoes, 79 vetoes, 65 of which had bipartisan support. Everything from clean energy to addiction treatment services to universal background checks to paid family and medical leave insurance to an independent bipartisan redistricting commission. And we have distinctly different views, not just on policy, but on approach. I work together with Republicans on all of these issues. Distinctly different approach from Kristen Nunu. And on policy, I support protecting and strengthening the Affordable Care Act. Kristen Nunu has a long history of opposing it and wanting it repealed, just like Donald Trump. On choice, I am pro-choice and have a long history of standing up for reproductive health care rights. Kristen Nunu says he's pro-choice, long history of anything but. On clean energy, the differences couldn't be more night and day. Kristen Nunu says the jury's out on climate change. I think the jury's been in for a long time, and we got to do substantial steps. And we have a clean energy plan on our website, getting to 0% fossil fuel by 2030. So Racial justice. I happen to believe, which is just the facts, that systemic racism exists. Chris Sununu and Donald Trump have said systemic racism doesn't exist. And the first step in combating systemic racism is acknowledging it exists. So there's some pretty clear differences in this race for governor and how we move forward. I'm of that fundamental belief that we are all in this together. That in order to move New Hampshire forward, we can't afford to leave anyone behind. We fight to lift people up, not tear people down, and include more people in our democracy and economy, not exclude them. And we fight for a real relief and recovery effort that works for everybody, not just those at the top, not just corporate special interest donors. Everybody matters. Everybody counts in this effort. So we got to move forward together. I look forward to the discussion on so many issues, from schools to healthcare, and look forward to having that discussion. Thank you so much. And before I forget, I respectfully ask for your vote in this race for governor. But more importantly than that, I respectfully ask you to vote. We need you to vote. We need you active and engaged in this democracy right now. That's a critical moment. And as Justice Brandeis said, there's no more important role in a democracy than that of citizen, not governor, not state senator, citizen. So thank you for being involved. Thank you for hosting this conversation. And thank you for going to vote. And when you're done voting, get your friends, get your family to vote too. So thank you so much. And I look forward to the conversation.
Thank you, Senator. Great remarks. Actually, let's start with some questions about unemployment. You know, it's interesting when you look at the national statistics, there are portions of our economy that actually have recovered. Manufacturing, a lot of the portions of the economy that can work remotely, but the face-to-face hospitality industry is still struggling. And I think that's the thing that a lot of us see. Their restaurants, their hotels, they're things that actually are really dependent on behaviors that are no longer okay. So what would be kind of policies or your approach to really understanding and addressing that over the next, 2 years, because the pandemic's not going away anytime soon.
Right. Well, thank you, Dr. Conroy. So in terms of the hospitality industry in particular, the CARES Act money that came in, $1.25 billion, Chris Sununu took unilateral control over it. We had recommended that the business relief go out to small businesses, and particularly geared towards restaurants and hospitality industry. That didn't happen, unfortunately. Some restaurants got some of it, but really a lot of bigger corporations got $350,000 a pop. In fact, 207 big corporations got $350,000 a pop, and our small businesses on Main Street were left behind, in my view. We have winter coming up. We know that with what's going to happen in winter, the restaurant industry in particular is going to get hit hard. My view is that we need to bridge the restaurant industry until the spring and make our plans for the spring and the summer. Get these small businesses through to the spring. Let's make it through and make it through together. Beyond that, on the 1.25 billion relief that came in, it should have been used more fully to stabilize our healthcare system. We got a lot of hospitals and providers in the red. Clinic in Charlestown was shut down. We got Lakes Region General Hospital filing Chapter 11. Hundreds of workers have been laid off and furloughed across the state. It should have been used to protect our healthcare system, first and foremost. This is a pandemic. We need to stabilize our healthcare system and work together with people on the ground. And recognize that sometimes people on the ground may have different ideas and may disagree with you. And that's okay. That's democracy. And that's how it should work. And the best ideas come from the ground up, not the top down. And I learned that as a legal aid lawyer, working with community organizations, working to build coalitions. So Those are a couple of the things that didn't really happen, that needed to happen, that need to happen moving forward.
Let's,
And
I
sure,
was
go
going
ahead.
to say, let's talk about the consequence of the unemployment. Because as you pointed out, as people become unemployed, not just furloughed, they often lose their health insurance. And
Right.
what are the options for them? Because Medicaid is kind of a tough program to get into as a kind of able-bodied adult, unless you have children and children that have special needs.
Yeah, this pandemic has really hit working people and working families on the chin. And I mean, they were taking it on the chin prior to the pandemic, and has really exacerbated that. So, our uninsured population in New Hampshire has tripled under the pandemic. And we already had the highest healthcare costs in the nation prior to the pandemic, and they're only going up. And so, for those people who have lost their employer based health insurance, and that's the primary reason why our uninsured has tripled, those folks have a few different options. They're not good ones, though. And our Medicaid population has gone up in part as a consequence of this. But what could have happened and what should have happened is the application for further 1115 waivers to allow for further Medicaid coverage for folks in this situation. I mean, more generally, though, people who are falling through the cracks right now, not just health insurance, but also not having the resources available to pay for rent, pay for housing. That's critical. And it's critical for healthcare outcomes too, to stabilize people in their homes. And I managed the Housing Justice Project at New Hampshire Legal Assistance for 4 years. And that housing first model works. And we passed legislation to protect renters and homeowners from foreclosure in this pandemic, renters giving them a shot. It wasn't rent control, and it wasn't a freeze on evictions. It was modest protections, giving people a shot to save their homes. That was vetoed by Chris Sununu. And unemployment insurance protections that we passed were vetoed by Chris Sununu. And so people are in a terrible spot right now. There's tens of thousands of people out of work and struggling, and they're losing their homes. There's 60 writ of possessions being issued every week now for evictions. And this hurts all of us. It's not just the wrong thing to do to allow this to happen. It hurts all of us. It hurts our economy. It hurts our healthcare system.
We do have a question from the audience. As governor, how would you work with the federal delegation and the White House to ensure federal dollars flow to New Hampshire? And I guess that's a bigger question. Do we get our appropriate amount of federal dollars for what we do as a state?
Thank you for the question. We get about, last time I've seen the data, we get about 82 cents on the dollar we send down to Washington, D.C. Certainly, Senator Hassan and Senator Shaheen have fought hard for New Hampshire and to get resources here into the state. Senator Shaheen worked on the PPP and among other programs to get help and relief into the state. The 1.25 billion was what Senator Hassan and Senator Shaheen fought for, when other states like New York only got like I think it's 3.5 billion. They've done a terrific job fighting for relief for the state of New Hampshire. What they're fighting for right now is something that Mitch McConnell and Donald Trump and Chris Sununu, unfortunately, don't support, which is a relief package that supports the budgets of the state of New Hampshire and our communities. And I believe that's critical to protect taxpayers and protect property taxpayers here in the state of New Hampshire. And so I'm grateful for them to continue to do that. I have open lines of communication with the senators. I don't have an open line of communication with Donald Trump. And I'll be blunt, I hope that it's President Biden coming up. I'm gonna do what I've done my entire life, is work with everybody and give it a shot. And that's what I've done as a legal aid lawyer. That's what I've done in the state Senate. That's what I've done as majority leader of the state Senate, is work with everybody regardless of their background and listen to people and not take things personally when people, say something that may disagree with me, because you don't move forward if you take that approach,
Yeah.
and just listening to people and working together and being a good partner. And that's the approach I'll take.
There is a question about how do we actually recruit new young people to the state of New Hampshire? We are one of the states in the country that have the oldest average age of our population. And I know that we have had not a decline in our numbers of young people. We've been kind of stabilizing, but how do we actually increase the number of young professionals to come to the state? Because once we're post-pandemic, we all need to be thinking about how do we actually grow the economy here.
Thank you. Yeah, absolutely. I mean, we have to attract and retain young people and young workers and families to the state of New Hampshire. And we know, both anecdotally and empirical, um, data about what are the motivators. Cost is a motivator. So we need to advance workforce affordable housing in the state. When the vacancy rate on rental housing is about 5% nationwide. In New Hampshire, it's about 1%. In some communities in New Hampshire, it's 0%, literally, which means that people can't find a place to rent or live, and no pun intended, the prices are through the roof. So that supply issue is a problem. We've moved forward a little bit on that in the last budget. I have a housing plan on our website that we advance workforce affordable housing, building off of my experience in that field, but also the work that we've done in the state Senate. So workforce affordable housing is critical. If you're graduating BC and you're looking at where to live, and it's collar communities of Boston versus Southern New Hampshire, and the rental prices are the same, if not more, in New Hampshire, that's going to be a driver to keep that person in the Boston area. So that's one thing. A few more things. Number two, paid family and medical leave insurance. We're pretty much on an island or getting there with respect to this. And for young people and families that are starting up, look, Aaron and I were fortunate with Iris and Josie. Aaron had access to paid family leave. We were out of legislative session. Um, that's time you don't get back with a new baby. And that attachment cycle builds those bonds, and it's shown to produce social and emotional and healthcare outcomes that last for a lifetime. And it's not just new kids, by the way. It's caretaking for seniors, caretaking for a loved one who may be in hospice, or dealing with maybe an opioid addiction or COVID. And paid family medical leave insurance was vetoed twice by Chris Sununu, and blocked. A third bill was blocked. All three of these bills were bipartisan, by the way. Bipartisan legislation that Chris Sununu stopped on paid family and medical leave insurance. So paid family and medical leave paid family medical leave insurance and workforce friendly, family friendly practices in the workforce are critical. So that's number two. Number three, clean energy. Young people want to live in places where that value clean energy, the value combating the climate crisis. We have a clean energy plan on our website. I mentioned at the outset that Chris Sununu says the jury's out on climate change, and has vetoed 14 pieces of clean energy legislation that we've worked on, 11 of them bipartisan. So again, the obstacle here is not a Democrat or Republican obstacle. It's a Chris Sununu obstacle to clean energy in the state. Fourth, I think, probably goes without saying that marijuana legalization is something that is overwhelmingly supported amongst younger people. And we're on an island on that in New Hampshire as well. And I support that if done in a common sense way. And those are just some of the ideas. Now, Dr. Conroy, there's no silver bullet here, but as my dad would say, there could be silver buckshot. And so you got to take a whole array of ideas, and these are just four of them that I think we need to move forward on.
Thank you for that. That's really kind of a complete approach to that challenge. Now, we've got another question from the audience. The Supreme Court will hear a case in November related to the Affordable Care Act. If the law were found to be unconstitutional, what would the impact to New Hampshire be, and what would you do as governor to address it?
It would be devastating. Over 100,000 granted status would lose their coverage. Medicaid expansion would go away, which is something as the lead Democratic negotiator on the reauthorization of Medicaid expansion and providing health insurance to roughly 50,000 granted staters. It's the lead way to combat the behavioral health crisis in the state. That would go away. Community rating would go away. Price caps would go away. Support for our community mental health centers would go away. Most of the essential health benefits and requirements would go away. The pre-existing conditions protections, we by and large, based on legislation I filed, Senate Bill 4 in 2019, by and large, those would remain in place. However, they're at risk because once you throw out the whole system, it starts to crumble in upon itself. And you would hear right away from the health insurers that it's impossible to manage the situation with the protections for folks with pre-existing conditions without the Affordable Care Act. And so this is devastating. And let me just lay out the differences in the race and then talk about what we could potentially do if that happened. So first, Judge Barrett was voted out of committee in the U.S. Senate against the rules of the Senate Judiciary Committee. And Donald Trump and Republicans are pushing forward on Judge Barrett, who has a long history, documented history of antithesis towards the Affordable Care Act and questioning its constitutionality. So it appears as though Judge Barrett's going to be on the U.S. Supreme Court, and it appears as though Judge Barrett's going to be on the U.S. Supreme Court in time for the November 10th argument on the constitutionality of the Affordable Care Act, which means that in all likelihood, Judge Barrett will be a vote to overturn the Affordable Care Act. So this is on the ballot. This is a huge issue. Healthcare is on the ballot. And by the way, it's not just healthcare that's at stake with Judge Barrett. She has a long history of antithesis towards reproductive healthcare rights. And so Roe v. Wade is, in the crosshairs. And if that happens, Donald Trump says it'll be up to the states. So healthcare and choice will end up being up to the states. And so on healthcare, when Chris Sununu ran for the first time for governor in 2016, he said he's running on a pledge to repeal Obamacare. When he was asked in 2016 why he supports Donald Trump, he said because Donald Trump will finally actually get rid of horrible programs like Obamacare, quote unquote. In 2017, when legislation went through the US House to repeal the Affordable Care Act without a replacement, he called it a huge win, unquote. And then when it went to the US Senate, fortunately, Senator Hass and Senator Shaheen, working with the late Senator John McCain, voted that down. And so there's a long history here of opposition to the Affordable Care Act and the baseline underlying structure and principles of the Affordable Care Act on the side of Chris Sununu. And what does that mean? Well, it means if you're going to pick up the pieces, if this is thrown out, I think you probably want someone who believes in the pieces to begin with and is going to work together with our healthcare providers, work together as best as possible with the insurance community. I've had a lot of fights with them over the years, but always working together and look out for our families and our businesses here in the state of New Hampshire. And that's what I'll do.
Senator, even with all of the kind of backstops of the Affordable Care Act, one aspect of healthcare that we have struggled with, and I can tell you there are weekends where we have 15 behavioral health patients boarding in our emergency room, is access to care for people with mental health issues. And it's increasing, but demand in communities where we don't have the supply of behavioral health providers, but also the need for involuntary beds at the state facility for those that really need intensive inpatient treatment. So as governor, what would be steps that you would take to kind of address how to kind of fix the situation? We used to have the best mental health care system in the country here, and we have disassembled it over the last 15 to 20 years.
Yeah. Yep. I mean, let's start with the baseline principle that we shouldn't treat mental health care any different than anything else. And in the state Senate, I led the effort on mental health parity to implement the Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equity Act at the state level, making sure that insurance carriers treat mental health services generally on par with other health services. So, and if you break a leg or you have a heart attack and you show up at the emergency room, you get treatment right away. Mental health treatment, not so much. That's not right, and that's not good for anybody. And it's not good for our providers on the ground to not have the services available. People on the ground who are doing the intake, and I don't think they feel great about the fact that they can't refer them to some place that is meaningful for their situation. And so what we need to do is stand up the services across the continuum of care and mental health. And that means, and it doesn't mean just DRF. It means making sure that we have it recovery housing, we have transitional housing, we have the facilities available, and we have services in the community. And that's why I sponsored Senate Bill 14, which was to provide a statewide mobile crisis intervention and stabilization team for children who are child protection involved or not, but reaching those children within 1 hour, regardless of where they live in the state. It's the best practice. I went down to New Jersey with a bipartisan group to take a look at their structure on this, and that's informed the drafting of the bill. Worked together with a lot of providers, folks that are probably on this, that I know are on this Zoom call, and we put that together. We passed it. We funded it in the budget, and it has not been stood up by Kristen Noonan. And just last week or the week before, after pressure, after talking about this on the campaign trail, he finally went out to an RFP on it. Literally, after it's been funded, I mean, we got the budget done last fall, and then we saw 27 kids at one point waiting, 27 children waiting for mental health treatment in our emergency rooms that could have gotten services in their community if this had been stood up. Mm-hmm. And in a pandemic, that's especially critical to make sure that if we can, if at all possible, provide those services in the community. And I think this is obviously I feel strongly about it. I think it's outrageous that Kristen Noonan did not stand that up. We need to move forward. And on day one as governor, I'm going to look out for working people and families and people who are falling through the cracks and making sure these services are stood up. And I was a legal aid lawyer during the last economic crisis, the Great Recession. I saw what happened when people decimated that budget. I was on the ground helping people. And New Hampshire legal assistance budget at the time got decimated. 2/3 of my colleagues were laid off. Our caseloads went up to 90 or whatever. At a time when people needed it most, the services were cut the most. I guarantee you 100% on day one, that's not happening with me as governor. No way.
Well, I think we've kind of run over our time, Senator. It's been great to speak to you this morning. And thank you so much for everything you've done for the state. And we really wish you all the best luck over the next few weeks.
You got it. Thank you so much, Dr. Conroy, and to everybody watching, thank you so much. Take care now.
Thank you. Bye-bye.